Today we are going to discuss transversalis fascia. In our previous video, we discussed about the rectus sheath and how transversalis fascia takes part in formation of the rectus sheath. Now transversalis fascia, this is the fascia which lies in the inner surface of the abdomen, separated from the peritoneum by the extraperitoneal fascia, i.e. We can say this is the abdomen. This is the anterior side of the abdomen and this is the posterior side of the abdomen. Now, and here this is the transversus abdominis muscle. We can say transversus abdominis muscle. Behind the transversus abdominis muscle is the transversalis fascia, a fascial lining that covers the transversus abdominal muscle, and from the inner side of the abdomen, from the inner side of the transversus abdominis muscle. And this inside the abdomen is the peritoneum, and in front of the peritoneum is the extraperitoneal fascia. Now we can see this is how we say transversalis fascia is separated from the peritoneum by the extraperitoneal fascia. For example, here this is transversus abdominis muscle and this is the peritoneum. Behind the transversus abdominal muscle is the transversalis fascia, and transversalis fascia is separated from the peritoneum by the extraperitoneal fascia. Okay, extent of the transversalis fascia. Anteriorly, it is adherent to the linea alba. Linea alba is the midline, which is the fusion of all the aponeurosis of all the abdominal muscles. And posteriorly, it is continuous with the thoracolumbar fascia, and laterally with the renal fascia. Renal fascia means the fascia of kidneys. And in the medial aspect, it is attached to the pubic crest, pubic tubercle, and pectineal line. If we discuss about the superior attachment, superior it is continuous with the diaphragmatic fascia, and inferiorly it attaches to the inner lip of the iliac crest, and lateral 1/2 of the inguinal ligament. Now we are going to discuss more about the transversalis fascia. How transversalis fascia forms the deep inguinal ring. Deep inguinal ring is the oval opening in the transversalis fascia 1.2 cm above the mid inguinal point. Okay, now the contents of the deep inguinal ring. Deep inguinal ring transmits spermatic cord in the males and round ligament of the uterus in the females. It is extended above the spermatic cord as the internal spermatic fascia. For example, this is the oval opening in the transversalis fascia, and its edges elongate as the internal spermatic fascia over the spermatic cord. And how transversalis fascia forms the femoral sheath. Okay, femoral sheath. We are going to touch this topic a little bit. Femoral sheath is basically projection of the transversalis and iliacus fascial linings that covers the femoral vessels, femoral arteries and veins, femoral lymphatics 1.5 inches behind the inguinal ligament, but femoral sheath does not cover the femoral nerve. Now, below the arcuate line, rectus muscle lies directly on the transversalis fascia. Transversalis fascia we discussed in the video of rectus sheath. And between the anterior superior iliac spine and the pubic symphysis, we discussed above this as well, that transversalis fascia forms the internal spermatic fascia and deep inguinal ring. Transversalis fascia continues below with the similar fascial lining with the pelvic walls. Continuously, this fascia is named according to the structures that is overlies. For example, superiorly we studied in its relations that superiorly it is continuous with the diaphragmatic fascia because it is covering the diaphragm, and below transversalis fascia, and then further below psoas fascia, quadratus lumborum fascia, and iliacus fascia. The abdominal wall and lymphatics lie inside this fascia while nerves lie outside of it. This is the main point. Now, what is extraperitoneal fascia? Thin layer of connective tissue, contains variable amount of fat, and between transversalis fascia and parietal peritoneum. What is parietal peritoneum? Lining deep sides of the abdominal walls, thin serous membrane, and continuous below with the parietal peritoneal wall. Now we are going to discuss the nerve supply of the parietal peritoneum. Phrenic nerve. Phrenic basically supplies the diaphragm. So here we can conclude that it will supply the central part of the diaphragmatic parietal peritoneum, and lower intercostal nerves, peripheral part, segmental intercostal and lumbar nerves, overlying muscles and skin, peritoneum lining, anterior and posterior abdominal walls.